So the symptoms of coronavirus infection, which is called COVID-19, are primarily respiratory. Most people will develop cough and fever along with some shortness of breath. Occasionally people can have some GI symptoms such as nausea and vomiting as well, but primarily respiratory symptoms are what we see in most cases. Coronavirus is primarily spread person to person through droplet contact, so that would be within 6 to 10 feet of somebody when they're coughing or sneezing. We can help prevent that by wearing masks. If everybody were wearing masks, then we would have less droplet spread from person to person. The coronavirus can also live on surfaces, and so it can be spread from person to person via those surfaces. So you need to be smart. If you've touched a surface, then you need to wash your hands or use hand sanitizer. And also just avoid touching your face, your nose, and your eyes, because that's another way the virus can be passed from person to person. So there are a lot of different masks out in the community right now. And for instance, when you go to your healthcare provider's office, you might see people wearing simple paper masks or surgical masks. You might see people wearing cloth masks. You hear of people wearing N95 masks, and all the way to the positive pressure hoods that providers will wear at some times. So the main thing to think of is that when you are walking around and you're trying to prevent spreading the virus to anybody else, any barrier mask will do. So a bandana is fine. A cloth mask like the one my mother made for me is perfectly fine. Or a paper surgical mask is great, but those don't last as long. When you're in a healthcare setting, providers will vary what type of mask they're using based on the patient encounter, the symptoms, and the procedures being performed. If you're concerned about having the coronavirus and you have general questions, you could start by calling the Department of Health's hotline. If you are ill with it, you should call your primary care provider's office. They have clinics set up and screening tools set up and ways to get you in for care. The urgent care is another option that is available throughout much of the day here, including drive-through testing for patients who have symptoms. If you're feeling like you are very sick from this, for instance, if you're having a hard time breathing, you can't catch your breath, your oxygen saturation is low if you have a way to measure that, then you should get to the emergency department or call 911. If you do go to a healthcare provider for testing, they'll generally ask you some screening questions such as what your symptoms are. They might ask about travel history. They might ask if you have been in contact with anybody who's been potentially sick or who you know has been infected with this virus. They'll check your vital signs, they'll check your oxygen saturation and your temperature, and then based on those screening criteria and based on your symptoms, they'll determine whether testing you is appropriate or not. If you get tested, there are a couple of different types. One is a swab in the nose, one is a swab in the mouth, and those tests get sent currently to laboratories outside of Walla Walla, and so that can take anywhere from 2 to 7 days right now, depending on the volumes that those laboratories are dealing with. After you get tested for coronavirus, and while you're waiting for those results, we instruct all patients to stay isolated at home. This helps prevent you potentially exposing anybody else until you have those results.